The Nightly Symphony. Understanding snoring. We've all heard it. The rumbling, whistling, or snorting sounds that erupt from our loved ones, or even ourselves during sleep. These sounds can be disruptive and annoying, but they are more than just a nighttime nuisance. That's snoring, a common sleep issue that affects millions of people around the world. It can lead to restless nights and strained relationships. Snoring happens when air struggles to move freely through your throat while you breathe in your sleep. This can be due to various reasons, including the relaxation of muscles in the throat. This obstruction causes the surrounding tissues to vibrate, creating those familiar snoring sounds. The vibrations can vary in intensity, leading to different snoring patterns. Several factors contribute to snoring, including the anatomy of your mouth and sinuses, alcohol consumption, allergies, and even nasal congestion. And even your sleep position. For instance, sleeping on your back can make snoring worse. Understanding the cause of your snoring is the first step to finding the right solution. Consulting a healthcare professional can provide insights and potential treatments. While snoring might seem like a minor nuisance, it can sometimes signal a more serious underlying sleep disorder like sleep apnea. Addressing snoring can improve your overall sleep quality and health. Lifestyle makeover. Simple changes, big impact. The good news is that for many people, simple lifestyle changes can make a world of difference in reducing or even eliminating snoring. These changes are often easy to implement and can lead to significant improvements in your overall sleep quality. One of the easiest adjustments is changing your sleep position. By simply altering the way you sleep, you can open up your airways and reduce snoring. Sleeping on your back often worsens snoring, as gravity causes your tongue and soft palate to relax and block your airway. This can lead to interrupted sleep and daytime fatigue. Try sleeping on your side instead. This position helps keep your airways open and reduces the likelihood of snoring. You can use pillows to prop yourself up or try a special pillow designed to encourage side sleeping. These pillows are specifically designed to support your neck and spine, making side sleeping more comfortable. Another culprit behind snoring is excess weight. Carrying extra pounds, especially around your neck, can contribute to snoring. Fatty tissue around your neck can put pressure on your airway, making it harder for air to flow smoothly. Losing weight through a balanced diet and regular exercise can help reduce this pressure and improve your sleep. Home remedies. Your bedroom. Arsenal against snoring. If lifestyle changes alone aren't enough, several home remedies can help combat snoring. Nasal strips, available over the counter, are a popular option. These adhesive strips gently lift your nasal passages, improving airflow and reducing snoring. Elevating your head with an extra pillow or two can also make a difference. This slight incline can help open up your airway and improve drainage, reducing snoring caused by congestion. Speaking of congestion, if allergies or a cold are contributing to your snoring, treating the underlying issue can provide relief. When home remedies aren't enough, medical interventions. For some people, lifestyle changes and home remedies might not be sufficient to address snoring. This is especially true for individuals who suffer from more severe conditions like sleep apnea, where the airway becomes blocked repeatedly during sleep. In such cases, medical interventions can be explored. Consulting with a healthcare professional, can help determine the most effective treatment plan tailored to your specific needs. Continuous positive airway pressure, or CPAP therapy, is a common treatment for snoring, particularly when associated with sleep apnea. This method is highly effective in maintaining open airways throughout the night. CPAP involves wearing a mask over your nose and/or mouth while you sleep. The mask is designed to be comfortable and unobtrusive, allowing for a restful night's sleep. The mask is connected to a machine that delivers a constant stream of air, keeping your airway open. This continuous airflow prevents the airway from collapsing, thereby reducing snoring and improving sleep quality. Another option is oral appliances, which are custom-fitted devices worn in your mouth during sleep. These devices are often recommended for those who find CPAP machines uncomfortable or inconvenient. These appliances help position your jaw and tongue to keep your airway clear. By adjusting the position of these structures, oral appliances can significantly reduce snoring and improve overall sleep quality. Section 5. Kicking the habit. Smoking and its impact on snoring. We all know smoking is bad for our health, but did you know it can also worsen snoring? Smoking irritates the lining of your nasal passages and throat, causing inflammation and congestion. This inflammation narrows your airway, making it harder for air to pass through and increasing the likelihood of snoring. Quitting smoking not only benefits your overall health, but can also significantly reduce your snoring issues. Section 6. Breathe easy. Exercise and nasal hygiene for snoring relief. Regular exercise is beneficial for countless aspects of our health, and snoring is no exception. Exercise helps strengthen the muscles in your throat, which can help prevent them from collapsing during sleep. Even moderate exercise, like brisk walking or swimming, can make a difference. In addition to exercise, maintaining good nasal hygiene can help alleviate snoring. Rinsing your nasal passages with a saline solution before bed can help clear out mucus and allergens that might be obstructing your airway. Section 7. Seeking expert advice. When to consult your doctor. While snoring is common, it's important to know when it's time to consult a medical professional. If you've tried lifestyle changes and home remedies without success, or if your snoring is accompanied by other symptoms like excessive daytime sleepiness, morning headaches, or pauses in breathing during sleep, it's crucial to seek medical advice. Your doctor can evaluate your snoring, determine the underlying cause, and recommend the most appropriate treatment option. Section 8. The importance of a good night's sleep. We all know how important sleep is for our physical and mental well-being. When we don't get enough sleep, we feel tired, sluggish, and irritable. But did you know that chronic snoring can significantly impact the quality of your sleep? Even if you don't wake up fully during the night, snoring can disrupt your sleep cycles, preventing you from reaching the deep, restorative stages of sleep your body needs. This sleep disruption can leave you feeling tired and groggy during the day, even if you think you've slept for a full night. Section 9. Partner. Snoring, navigating shared sleep challenges. Snoring doesn't just affect the person snoring, it can also take a toll on their bed partner's sleep. The constant noise can make it difficult to fall asleep and stay asleep, leading to sleep deprivation and frustration. If your partner's snoring is disrupting your sleep, it's important to address the issue together. Encourage them to try the lifestyle changes, home remedies, and medical treatments we've discussed. Open communication and a willingness to find solutions together can help both of you get a better night's sleep. Section 10. A quieter night, a brighter tomorrow. Embracing a snore-free life. Snoring is a common problem, but it doesn't have to rule your nights. By understanding the causes of snoring and exploring the various lifestyle changes, home remedies, and medical treatments available, you can find relief and enjoy quieter, more restful sleep. Remember, addressing snoring not only improves your sleep quality, but also benefits your overall health and well-being. If you're struggling with snoring, don't suffer in silence. Take charge of your sleep and embrace a brighter, more energized tomorrow.